Prescription drugs still account for just a small part of the healthcare dollar. The problem is that it's rising rapidly. Now, if you talk to the drug companies about this, they say, yeah, prices are high, we know that, ain't it awful? But they say we have to charge these high prices to cover our research and development costs. If there were to be any kind of price regulation, that would stifle innovation and we wouldn't be able to bring you all the medical miracles that we're now bringing you. None of that is true. None of that. From the beginning to the end, except the part about the prices are high. That is indeed true. If you look at just the top drug companies in the United States in 2005, their sales came to $222 billion. They spent $32 billion of that on R&D. But look at what they spent on marketing and administration. $71 billion, over twice as much as they spent on R&D. And after these expenditures, they even kept more in profits. $39 billion. Their profit margin was 16%, as compared with less than 6% for all the Fortune 500. So when they say, well, we have to recover our R&D, yes, but what you're really covering is your outrageous marketing expenditures and your obscene profits. That's what you're doing, and that's what all of these high prices are covering. When the FDA considers a drug for approval, it has to be found reasonably safe and effective. But effective compared with what? Now there is the loophole. It doesn't have to be found more effective than other drugs already in the market to treat the same condition. It merely has to be more effective than a sugar pill, than a placebo. In the absence of any data whatsoever, what the drug companies do is to promote these new drugs as though they were better. And that's what you see on the direct-to-consumer ads and the marketing directed to physicians. These drugs are usually targeting fairly minor conditions in essentially healthy people. Hard to define, vague conditions like social anxiety disorder or erectile dysfunction. These kinds of diseases that can be expanded with enough advertisements, you can convince every young man that he has erectile dysfunction. You can convince every man and woman that they have social anxiety disorder, because who hasn't been shy from time to time? I'm not somebody who believes that it's all the patient's fault. I think that they are vulnerable to the marketing hype, so they go to their doctor, and the doctor also believes what the drug companies have been telling him. So he reaches into his cabinet full of free samples of the very most expensive brand name drugs with long patenting lives ahead of them, and says, well, here, try this and see if you feel better. And gets rid of the patient in a hurry. It'd take longer to convince the patient that he didn't need a drug. And the patient feels, this is a good doctor, this doctor took good care of me because the prescription is proof of that, and it validated the ad, and the patient goes away with an expensive drug that he and the doctor are both hooked on from that moment on. When the free samples run out, he's still taking that drug. About $40 billion of their gigantic marketing budget is unaccounted for. So what might that be? I think it's marketing to doctors, but under a different name. It's education.
I find it humiliating as a psychiatrist to encounter the story which appeared in last week's New York Times about the payments made by drug companies to psychiatrists in Minnesota. If I recall, it was approximately that those doctors who had received $3,500 or more, as opposed to doctors who had received no money or less than that critical amount, were prescribing drugs that should not be given to children 3.5 times more often, being quietly on the take from the company that manufactures the drug that you're selling your patient you're giving your patient, you're writing for your patient that he takes in good faith, makes the profession itself look so sleazy that it undercuts the basis for a trusting doctor-patient relationship.